Hi guys, this is Michelle Gravengood, and my topic is on hypertension. So, a little bit about why I chose this topic. I feel like I see hypertension in every patient I take care of in multiple clinical settings. And I feel like it's such an important topic because it is so prevalent and it's an epidemic that we're experiencing. And it's fascinating to me that it does so much damage internally, yet doesn't show any outward signs. So I think it's so important, and I myself wanted to learn more about it so that I can help my patients in the future when I become a nurse. And also, I found it fascinating that hypertension, extreme hypertension, can lead to Press syndrome. And I've never heard of this syndrome before, and it was really intriguing to me, which is also why I kind of wanted to choose hypertension as well. So, just a quick background on Press syndrome, it's known as posterior reversible encephalopathy syndrome. And it's basically an interruption in brain function. It's very rare, but they are starting to do more studies on it, and it presents as a rapid onset of headache, seizures, altered level of consciousness, and severely elevated blood pressure. Now, the provider thought that my patient possibly had this diagnosis, so I wanted to kind of look further into it, and it was just interesting to me. So, my patient was an 89-year-old female, we'll call her JS. She was admitted to the ED with altered level of consciousness, weakness, vomiting, and extremely elevated blood pressure. She has a history of right sided facial droop from previous stroke, hypertension, and diabetes type 2. Her meds that she's currently on is IV Rocephin for 7 days to treat a UTI infection, IV labetalol, which is an alpha and beta blocker, every 4 hours to decrease that blood pressure, and Isodil, which is an aspirin, 3 times daily because she is at an increased risk for stroke and MI due to the elevated hypertension. So, her labs that she had was the EKG showed mild slowing on the left side. She had a positive culture for Aerococcus sanguinicola, which is a UTI infection, and her potassium was low at 3.2 and 3.4. Her vital signs, blood pressures were 188 over 75, 220s over 104, 197 over 74, heart rate 103, 98% on room air, and respirations of 18. So, the background about hypertension, it's defined as intermittent or sustained elevation of diastolic or systolic blood pressure. You have to have a reading of systolic 130 or higher in two or more readings and on two or more separate occasions. It's not just one reading on one time. And it affects so many people, 1.3 billion people, and it's more prevalent in African Americans, as I'm sure you guys have heard. So, the current practice on it is that a lower blood pressure, the perfect blood pressure of 120 over 80, does not necessarily mean that it is going to cause less mortality and less cardiac illness. They found that there was no advantage with having a lower blood pressure, lower meaning below 140 to 160. And if you're trying to overtreat with medication, you're going to have a higher risk, it's going to be costly, and it's going to be harmful to the patient as well. So, the big takeaway is to prevent with lifestyle modifications and treat with lifestyle modifications. So, decreasing the weight, eating foods high in potassium and calcium and low in sodium, and physical activity. So, they found if you choose just two modifications, that will help lower your blood pressure. This is applicable to my patient because she only needs to decrease her blood pressure to the target range. So she doesn't need it to be the perfect 120 over 80. She just needs it to be below 140 to 160. She needs to eat foods higher in potassium because she's low in potassium, and she also needs to increase her physical activity because she did mention she was a couch potato. So stage 1 is identified as 140 to 159 and over 90 to 99, and these are treated with thiazide diuretics, calcium channel blockers, ACE inhibitors, and ARBs. Stage 2 can be defined as 160 or greater, or over 100 or greater, and you're going to want to treat this stage with two different drugs of different classes. So, my first article was on blood pressure targets, and it was an evidence level of 1, which is the strongest level of evidence due to it being a systematic review or meta analysis of all relevant randomized control trials. They looked at if lower blood pressure targets, meaning below 135 over 85, are associated with the reduction in mortality and morbidity compared to the standard blood pressure of less than 140 to 160. And they did their methods with 6 randomized control trials with 50 participants in each group with a minimum of 6 months of follow-up. They found absolutely no difference in significant cardiovascular events or adverse effects when they were treated with a lower blood pressure compared to the standard blood pressure. Now, this is significant because a blood pressure within the standard range is obviously just as effective compared to a lower blood pressure. Now, we don't want to overtreat the blood pressure in patients that already have a blood pressure within the standard range because it becomes costly, it's harmful, and it's a higher risk with absolutely no added benefits. So this is applicable to my patient because she has such a high blood pressure already that just to get her in that safe range of the 140s to 160s is going to be better than trying to overtreat and make her in the 120 over 80 range. And again, like I said, excessively treating with pharmacological methods is not great for her advanced age and with the comorbidities she has. My second article is on self-care hypertension inventory psychometric testing. Now, this was an evidence level of 6, so it was a weaker evidence-based study, and it's from a single descriptive or qualitative study. Now, they looked at psychometric properties of the self-care of hypertension inventory, and I'll explain more what that is. So what they did is they took a 24-item questionnaire and questioned the 193 adults with chronic hypertension on maintenance, monitoring, and management of their blood pressure. Meaning, do they eat vegetables? Do they exercise? Do they monitor their blood pressure at home and take their medications on time? And what they found was patients who did all these things, basically practiced self-care, controlled their chronic hypertension effectively, as we would all expect. So the clinical significance of this is patients who practice in self-care with proper nutrition, exercise, medications, and home monitoring of blood pressure show an increased management of their blood pressure. And this is applicable to my patient because she was compliant with taking her medications for the most part and did home blood pressure monitoring, but she definitely needed improvement with nutrition and her exercise. So, an assessment, so general application, I'm going to look at her history for one. I'm going to assess her signs of hypertensive crisis because she would be in that because her blood pressure was so high. And I'm going to look at her level of consciousness. So, I'm going to assess for any dysrhythmias, any previous heart attacks, and I'm going to monitor that blood pressure frequently and determine if the labetalol is helping. And I'm also going to perform frequent neuro checks to determine if her level of consciousness is getting worse or better. So I'm also going to look at her lab levels, so BUN, creatinine, definitely her potassium and her sodium, and I'm going to look at the EKG for any abnormal results because her blood pressure is so high. So I'm going to look at her potassium levels super close to check for an increase or decrease because we all know that has a direct effect on the heart. And I'm also going to look for any abnormal rhythms that could be causing this hypertension to be extremely high. So I'm going to definitely administer those antihypertensive medications. I'm going to administer aspirin, and I'm going to encourage the patient to ask questions about her treatments because we know a lot of the older population sometimes just take medication without even knowing why they're taking it. So it's important for them to understand that as well. So I'm going to administer that labetalol every 4 hours. I'm going to administer that aspirin to prevent stroke and heart attack. And I'm going to be administering that antibiotic as well to treat that UTI to help with that level of consciousness. And I'm going to discuss with her about her medication regimen and other non-pharmacological methods to help control that blood pressure. So discharge teaching, I'm really going to help her look at her home blood pressure monitoring so she can keep a close eye on it. And I'm going to discuss the importance of keeping those follow-up appointments so she keeps that blood pressure in check and emphasizing how important it is to take those medications on time every day. So one thing I could do is have the patient write down or list her medication routine to ensure she's complying. I'm going to educate her on the specific medication she's taking so she knows why she's taking them and what they're doing to her body. And I'm going to educate on proper nutrition with low sodium diet, eating those fruits and vegetables, and incorporating a daily exercise routine. So evaluation, I want her to describe positive efforts on losing weight and restricting her sodium intake. I want her to verbalize basically an overall understanding of this chronic illness that she has. And I want that blood pressure to remain within the goal range. So the goals that we accomplished within her care was she decreased her blood pressure to her goal range of 146/88. Her potassium level was increased to a normal range of 3.7. She no longer had an altered level of consciousness and was alert and oriented times 4. And she described her home routine for taking her antihypertensive medications. And she listed appropriate foods to consume to manage blood pressure, so I know she understood that. So, some benefits that this monograph provided me to the patient was the importance of lifestyle modifications. They really hammered home on this subject, and I think it is so important, even more important in some instances than pharmacological methods in treating hypertension. So, those stress reduction techniques like deep breathing exercises, a hobby you enjoy to calm yourself down, and then really the exercise and nutrition regimen of exercising 30 minutes daily, that low sodium diet, fruits and veggies, and then definitely medication adherence for those who have the stage 2 hypertension and need more of the medications. So, taking those medications at the same time daily, refilling that prescription before it runs out, and having a plan. And definitely, it taught me more about laboratory values and their importance on just how electrolytes can cause damage to the heart and cause further problems if that potassium and that sodium level and magnesium level are thrown off balance, and to ensure that you're monitoring those laboratory levels daily so that you can adjust your care accordingly. So, in conclusion, lifestyle modifications can be the absolute best treatment when it comes to hypertension. They're inexpensive and it's a lower risk than pharmacological methods. And blood pressures within the standard range of the 140 to 160, less than 140 to 160, can be just as effective as a lower target blood pressure of the perfect 120/80. And also, sometimes don't forget to think outside the box for other causes of extreme hypertension. We all would have never have thought because we've never heard of Press syndrome, but it's very interesting to think about this syndrome could potentially cause this extreme elevation in blood pressure. And then last but not least, because nurses, as we all know, educate, educate, educate. Definitely ensure that this patient fully understands her chronic illness and how to successfully treat it so she can be successful in managing it. And that is all I have. Thanks, guys.